if you're struggling, the earlier you reach out for help, the better.
That's a good one.
Because the longer you wait, the harder it is to recover. So our brains can kind of spiral down very quickly.
Dr. Lisa Merlo is an associate professor of psychiatry at the University of Florida College of Medicine. She's a licensed clinical psychologist and has completed postdoctoral fellowships in both clinical child pediatric psychology and substance use disorder, epidemiology, and prevention. And she currently serves as the director of wellness programs in the UF College of Medicine. So thank you, Lisa. I think I am very curious to just first, how do you spend your time? Because I think from what I've seen, you do plenty of things, or study plenty of different things, and you also have the clinical psychologist work. Mm-hmm. So how does that look like? Is it mostly research and then kind of like spending time one-on-one with patients, or what is that process like?
It's a great question, and it's changed quite a bit over the course of my career. So I've been at UF. I came here in 2004 as a clinical psychology intern, and then stayed, as you mentioned, for a postdoc. And then since joining the faculty in 2007, even in that role, the work I've done has really varied depending on the year and sort of what projects I'm working on, what leadership positions I hold, those kinds of things. So at various times, I've done direct patient care, providing psychotherapy for mostly kids and adolescents, but some adults too. I have done, a lot of teaching, both undergraduate online courses, as well as a lot of in-person lectures and small group teaching for medical students and other health profession students, as well as medical residents who are completing their training here. I do presentations and seminars for faculty, particularly now that I have more of the focus on health professional well-being. I often will work with different departments or give presentations in different departments to look for ways to help improve the culture of wellness within their work environment. And then I do research primarily in the areas of health professional well-being and impairment. So I serve as the director of research for the state of Florida's Impaired Practitioner Monitoring Program. And so what that is when you have a licensed healthcare professional who has some sort of potentially impairing condition. It might be a substance use disorder. It might be a severe psychiatric disorder, cognitive decline, something like that. Then in order to help make sure that individual gets the treatment that they need and are restored to good health and are able to continue practicing, they're referred to these programs. Sometimes they're called physician health programs or professional health monitoring programs. And so then they are referred for appropriate treatment. And when the treatment's completed, then they work with the program over the course of 1 to several years, up to 5 years or so, just to ensure that the individual is maintaining their recovery and doing well. And then that actually helps to protect the patient population. So we don't want to have situations where individuals are practicing while impaired. And so this is an extra level of safeguard that, provides support and advocacy for these professionals to get the care that they need so they can function at their best, and also ensures that they are doing what they need to do to maintain their high quality functioning so that their patients can be well taken care of. So my research most of my research relates to that topic, these, this special niche population of healthcare professionals.
Yeah, and I'd like to definitely go into that. That can be the first thing we talk about, because that is very, very interesting, because these people are, I think almost everybody would agree, very important in society, right? Like there's always going to be something wrong with some person, and somebody would need to take care of that person. And ideally, that person taking care of other people needs to be mentally, physically fit.
Right.
Right. So, because lives are on the line, right? So I'm very curious on this, what would you say are, or even if you can call it like main factors that affect these health professionals? Like, would you say, and again, on the caveat that I don't know if there is even like main factors, or it's like an overall thing. But for example, what I'm thinking is like overexhaustion, like working many hours, or just the matter of fact that they're working with people, so that I imagine adds an extra layer of anxiety of like, oh, what if I make a mistake? This will happen. I think those, in my mind, are the most, at least stereotyped. What would you say on that?
Yeah, so I would say, first of all, healthcare professionals are human beings.
Right,
and so
important.
It's a lot of the exact same factors that put anybody else at risk, right? So there are hereditary components. There are, issues related to your environmental upbringing, related to your family of origin. Are you adept at good communication? Can you handle conflict effectively? All these sorts of good coping strategies that can be protective are the same in a healthcare professional population as in the general population, and also the risks. So, again, if you are someone who has an underlying anxiety disorder, like you mentioned, or an underlying tendency toward a mood disorder, depression, many individuals will seek out substances as a form of self-medicating that. Similarly to the general population, if you have chronic pain or an acute pain issue or some other medical condition where, maybe you are prescribed painkillers and, once you start taking them, for some people, that can be a very reinforcing experience where their brain responds in an extremely positive way. For other people, not so much. And so they have that protective effect that, not everyone has the benefit of. So in terms of the things that are more specific to healthcare professionals, yes, there are high levels of burnout and moral injury and compassion fatigue and all the things we've been hearing more and more about since the COVID pandemic, when there's really been a lot more attention shown on what a challenging job and work environment health professionals, exist within. Also things like access. So, prior to the opioid epidemic in the general population, where we have illicit fentanyl, coming over the border, those sorts of things, healthcare professionals had access to a lot of these high potency opioid medications through their work. And so
easier access than
exactly.
People,
and so that's an additional risk factor where, if you're handling these substances on a daily basis or seeing how your patients react to it, we see pharmacists who are passing these things out, they're filling the bottles, all those sorts of things. It's just more exposure. There's some hypotheses about, maybe it's actually the physical exposure that, handling these materials or inhaling these materials, in the operating room or, whatever it may be, that can enhance vulnerability as well. That's, that's up for debate still. Right. But, so there are a lot of different ideas and hypotheses. And then, just the personality type that goes into a health profession. So you have typically high-functioning, self-reliant people who don't necessarily like asking for help and, have very high standards for themselves. And so, having issues with feeling you're not living up to your ideals or you're not able to treat patients the way that you want to, or, these sorts of, again, like the moral injury component of things that can cause distress, even traumatic experiences. So if you're working in an emergency department, you see some pretty horrible things, right? If you're working through a COVID pandemic, a lot of our providers had to deal with really difficult human experiences. And so just like anyone else, there is a desire to dampen the pain, to, escape a little bit. And so for some individuals, they might turn to a glass of wine for that. And then maybe one glass becomes two. And then, it can get out of control just like for anyone else.
And that's interesting. And you've mentioned a lot of different things. For example, the substance use. I imagine, I was just going to ask you, like, what do you think are that specific population like higher than average, than the normal population? For example, do they consume more of those types of medicines to stay fit or like try to stay in the job? Would you say the anxiety part is the main one? And that's just like a quickly of like what do you think, and then the question is like how do you start helping them?
Mm-hmm.
Like,
yeah, so that question is also maybe a little bit up for debate in terms of are the rates really higher among healthcare professionals or are they pretty similar? It's hard to get really accurate data because, you know, first of all, it's hard to get data from anyone. Yeah, I don't know if you've ever sent out surveys, but response rates aren't always wonderful. You know, the diagnosis of a lot of these conditions requires going and meeting with a healthcare professional who can actually give you that feedback, right? That you have this condition, whether it's depression, anxiety, a substance use disorder. And so, you know, I'm not sure that we have 100% accurate rates for the general population or the healthcare professional population. It's probably pretty similar. Most of the data show there's probably slightly higher rates in healthcare professionals. Okay. But I would say it's probably related to a number of the things that we just discussed, right? So these high rates of workplace stress, you know, significant burnout, you know, this tendency toward wanting to solve problems yourself, self-medication, this idea that I'm a doctor, I know what I need, so I will just figure it out myself. And, you know, again, just the difficulty asking for help. And that is really related to stigma and the fact that in the healthcare field as a whole, there are a lot of barriers to accessing care. And it's getting much better now. But historically, you know, healthcare professionals had legitimate concern about how saying, I have a problem, I need help, might impact their career in a negative way. So would they lose their license? Would they lose their job? They lose their credentialing. And so there's been a huge movement just even in the past few years to do things like change the questions on the licensure application so that you no longer have to check a box that says, you know, I've had mental health treatment. Because what that did invariably is it would cause people to not seek treatment because they didn't want to have to check the box. And so the purpose of the question is supposedly to protect patients by not having individuals practice while impaired. But the consequence of the question is that you likely had more people practicing impaired because they were scared to seek help.
And I'm curious, where is your specific interest lie? Is it in that question of how do you make them seek out help? Or once we know that they need help, how do we help them? Maybe if it's different than a normal population or just the same approach.
Yeah, so I'm actually interested in the whole spectrum. Okay. And so, you know, I started on, you know, the extreme end of really looking at the individuals who are already in these impaired practitioner monitoring programs. So they are individuals who have had usually some major event in their life, at home, at work, whatever, that brought them to the attention or caused them to stand up and say, you know, I need help. So they were referred for treatment. They got treatment, and now they're recovering. And what I found in doing surveys and interviews and focus groups is that these problems didn't just appear magically when the person was in their 40s or 50s, but rather almost everybody had some symptoms by the time they were in professional school. So as a med student, as a dental student, as a pharmacy student, there were already, if not a diagnosable condition, at least symptoms or risk factors or other warning signs. And so that really got me interested about a decade ago in this other end, which is the well-being component, the wellness. How can we how can we make the learning environment, the training environment, and the work environment, you know, a better, more supportive space for these individuals? And so that's how I got interested in the wellness side. And so now I get to do both, which is great. Perfect. And I always kind of joke that I was into, you know, clinician well-being before it was cool, because now, again, since COVID, it's really gotten a lot more attention. And that's so important because prior to COVID, it was really something that was kind of swept under the rug. not just at any specific institution, but across the board, our whole country and really internationally, that this was a growing problem that people didn't want to acknowledge. But, you mentioned several minutes ago how important it is that we care for our healthcare professionals, because they are the ones caring for us. And we already have shortages of nurses. We already have shortages of physicians, particularly in certain areas. You might not have anybody within, a pretty wide geographic range who can even care for people. And so making sure that we, continue our investment in this really important resource that we have for our society, which is to have healthy healthcare professionals who can provide the care that the rest of us need.
So explain a little bit on the wellness side. So you've mentioned that you've noticed this tendency that problems that healthcare professionals have started while they were in school, basically. How do we help them? Like, what are the tools? Because I imagine, like, even in school, there's also a tendency of not seeking out help, right? Of this is what a student is supposed to do, kind of the grind, I imagine, like long hours. So yeah, what do we do with that?
Yeah, I mean, there's kind of been a tendency historically of like, I had to suffer through this, you should too.
That's true, yeah.
And so there's really a movement in the whole field of healthcare now to put a stop to that cycle, that we're realizing, why are we eating our own? Why are we doing this to our trainees? Why are we perpetuating what was an unhealthy environment that we experienced? Why would we want to do that to someone else? And so, again, it's wonderful because this whole field is sort of burgeoning and growing, where there's an increased understanding and an increased willingness and dedication to doing something about it. So what I will say, what the answer is not, is to tell people, like, just take a yoga class. And unfortunately, that was, again, traditionally what the response had been. And so there's still quite a bit of cynicism across many healthcare professionals about, what wellness is or what it means, or why would you have well-being programs, or what's the point, because, the system is broken. And so now the strategy is really much more comprehensive. So as the director of wellness programs for the College of Medicine here at UF, I use what's called the Stanford model of professional fulfillment as sort of the guiding framework.
Okay.
And I like that model because they put the center goal is professional fulfillment. So what that means is we're trying to create an environment where people are happy at work, they find meaning in what they do, they're feeling satisfied with their job, they feel supported by their colleagues, that, people who become a physician have spent decades of their life preparing to do that. And so we would hope that they're actually finding fulfillment in practicing that career, right? Same with any other health professional. So in the model, though, that's the center, that's the goal, and then there's 3 components that play into that. And the first is the culture of wellness. And this is something that is part of the organization, the institution, the environment. How does it feel when you come here to work or to learn or to train? Is it full of collaboration and cooperation and good communication? Or is there a lot of conflict and competition, right? So it's a lot of C words, but it gives you a picture of, what it feels like. Do you feel supported by your colleagues? Do you like them? Do you have relationships with them? Is this a place where you are happy when you're walking into work? The second component is what's called efficiency of practice or efficiency of process. Sometimes it goes by different names. And this is, again, an organizational, institutional issue. How is your work environment set up to make it easier or harder for you to do the work that you do? So how much time do you spend on, unnecessary bureaucratic paperwork, on meetings that go too long? How many hundreds of emails do you get every day? How many other types of communications are you expected to read? So with a clinician, they have their email, they have their text messages. They might have their secure chat messages. They have MyChart messages from their patients. They have other messages coming through the electronic medical record from other clinicians. It just becomes overwhelming.
Right.
And people have this immense cognitive burden.
Right.
Because how can you keep track of all of these things, And so it's hard to really focus on doing the work that they're there to do, which is to care for patients. Physicians are happiest generally when they're engaged in patient care. And there's data showing that, especially in some specialties, physicians now spend more time in front of a computer than they spend in front of patients. And that's not why they went to medical school, right? That's not why they dedicated their 20s to a residency program. It's they want to do good and be helpful and heal people. And so the more required online trainings you have and the more check boxes you have to click and everything else, all of those things detract from the experience of professional fulfillment. And so another component is, trying to do what's called job crafting and matching people's job tasks with what they find most enjoyable. So, for example, at an academic medical center like here, there are various things you can do. You can be providing direct patient care, but you might also be doing research, or you might also be teaching, and that might be classroom teaching or bedside teaching. And so different people enjoy different things, and maybe at different points of their career, they have different interests, or, it fits better or worse based on what's going on in their home environment, those kinds of things. So again, connecting, making that match between how can I work efficiently doing a job that I like, that's part of the thing that the job can help with, right? And then there's technology too. So Zoom has been very helpful in some ways because, you don't have to drive across campus or across town to go to meetings anymore. But it also is a detriment sometimes because having that in-person connection is super important. Same thing with the electronic medical record. There used to be a lot of good collegial collaboration that would occur in the nurse's station around the paper charts because everyone had to go there to write their notes in the same charts. They were all, forced to sort of
physically be near to each other, right?
But now everyone's sort of in their own silos at their own computer, and you may not see the other people who are caring for your patient. And it's those incidental, bumping into people where that can actually make patient care better because you have opportunities to ask these questions or to provide some feedback or things that maybe you don't want to take the effort to send an email about or whatever. But if you see the person, you can kind of discuss it in the moment. And just getting to know your colleagues better so that, again, it feels more supportive and friendly when you're there. And then the final component of that framework, the professional fulfillment, is personal resilience. And that's the part that usually gets all the attention, right? That's eat well and get enough sleep and exercise. Doing things like yoga and meditating are great. Right. And there is a lot of research, particularly to support the benefits of mindfulness and meditation in healthcare professionals. But that's not enough to overcome the organizational part.
Exercise, nutrition, as you mentioned.
Right.
Those three, maybe you could call them, or there's probably more.
Yeah, there's a lot more. I mean, it's, if you need therapy, if you need some counseling because you're feeling depressed, or you need some coping skills, or you need mentorship, or whatever it might be, there are things that we need to do personally for our own, self-care. But self-care is not enough to counteract a toxic work environment. And so it's those other two components, the culture of wellness and the efficiency of practice, that really a lot of times drive these experiences of burnout and exhaustion and, moral injury. And so all of them are important. But
and this is very, very difficult because I imagine you have to have different people's very specific in each of their own areas, because each of their own areas are pretty tough. I imagine there's not a single solution of everything. It's do this every time and it'll work right. They're complicated problems.
Absolutely.
Maybe we can stay a little bit longer on the professional fulfillment side, because you do have a excellent TEDx talk talking about that, kind of like just finding meaning into what you do. And I really liked it, because would you say it's, in a nutshell, kind of is, if you like what you're doing, like really like what you're doing, and what is it that you're doing, it's has some sort of healthy relationship, that you set yourself boundaries, and like you're aware that you're not overworking yourself or whatever, would that eventually, just those things, lead to a productive member, right? Like a productive person that is good at what they're doing, and does their job good and contributes to whatever that job means.
Mm-hmm. Yeah. So the interesting thing about that, so, with this idea of professional fulfillment, of having a job that you really love, of having a job that brings you meaning and purpose, and you feel good about it, it doesn't mean that your very first job out of college is going to be 100% that, right?
Yeah,
so a lot of times the purpose and the meaning of your job might be to be working towards something bigger and grander, right? Like, I didn't necessarily love the time I was spending, studying for my qualifying exams or typing my dissertation, but I was feeling fulfilled by the fact that this is getting me closer to my goal of becoming a psychologist, so I can help people.
Yeah, and just to interrupt you, you had an excellent quote at the end. If I remember correctly, is, oh my God, I lost it. It was, do you remember the quote? It was like, not trying to find meaning in what you do. It's like, no.
Yeah,
I don't remember, but it's like finding meaning into like anything that you do.
Right. You might not have a job that feels immediately meaningful to you in the present moment, but you can find meaning in the work itself.
Right.
Perfect, and so, everyone is contributing something. And so the way that you think about your job can have such a big impact. Like, you hear the stories about people who are in the janitorial service in the hospital, and you can say you could have a perspective that job is not meaningful, or you can have the perspective that this person is keeping the environment clean, which will allow the patients to be in an environment where they can recover. So they are saving lives in their own way. And that is very meaningful, right?
It's like plumbers are saving, like, also like almost the same amount of lives that doctors are saving, or even more. Something like that.
Right. Or, even thinking about maybe the fact that I am doing this job, and so it's giving me a paycheck, which I'm using to support my family. It might not be that it's the job itself that I'm super excited about, but it's the fact of having this job and what it means for me as a person, that I can be doing good as a result of that.
And that's wonderful. Even it can be like the simplest thing of like, this is my first job, and I'm trying to like figure out what I want to do, and I'm trying to like develop myself as a professional, whatever that looks like. And even though I'm like even though I'm like being a cashier or something like that people normally think of like I don't know, like a lesser job, whatever, that is cool, right? Like, it is amazing that I'm a cashier, like, I'm starting this progress, or even if I'm the end of this progress, like, I'm ending this thing doing this, that I get to interact with people and whatever.
Exactly. Yeah. As a cashier, you have a lot of opportunity to bring joy to other people's days, whether you're smiling and friendly and, how quickly you're doing your job, whether you are, making eye contact, whether you are loading the product carefully into the bag or smashing it in there. There are things that we can do in any job to make it more enjoyable or more meaningful.
Yes.
And it's very much a matter of our attitude and our perspective.
And even as a student, right? Because I imagine that would be like the most, the biggest audience that this can have is like, even if I'm just studying for like, I don't know, a humanities course, that even though I'm a doctor or a medical student, I need to take this humanities course and whatever. But that's cool, right? Isn't like just cool to think it's like, oh yeah, I'm just spending my whole time just learning. Right. Which I don't get to do basically almost ever when I graduate. So like, why not just enjoy the learning while it's there?
Absolutely. And it may end up that something in that course ends up really profoundly impacting something in the future too.
Yeah.
You may connect with a patient in the future because of something you learned in that course. Or you may have new insight into a scientific problem or a clinical challenge because of something you learned in that course. You never know. And on the flip side, sometimes the value of a job or a class or a task is you're learning what you don't love.
Yeah,
and that
absolutely.
is equally important.
Absolutely.
You know, there are so many times where we feel like we have to follow some prescribed pathway that, you know, this is what's expected of me, or this is what you have to do to get to this goal. And honestly, a lot of the time, that's not true. You know, there might be a more typical pathway to get places, but it doesn't mean that that is the only pathway. And sometimes when you have a job or a position or an opportunity, learning that this is not for me, I never want to do this again.
It's extremely valuable.
Right. Because that will help steer you, again, back to that job crafting, towards an eventual goal that is a good fit. So you can have a career that's meaningful, or you can have, you know, I call it an occupation. It doesn't have to be even a paid job. You know, people have different occupations in life, different vocations in life. Maybe it's, you know, volunteer work. Maybe it's a hobby that you have outside of your paid work. Maybe it's parenthood, you know, whatever it might be. But, you know, identifying for yourself what really matters to you. What are you passionate about? What lights you up? Because it's different for everyone. And I think it takes longer for us to recognize that than maybe it should. But I mean, I was several years into my faculty position, and I had this one task that I was responsible for. And I just dreaded it. It was the worst part of my week all the time. I hated it so much. And I felt, well, you know, I'm just paying my dues. You know, this is what I have to do.
It is what it is, kind of a thing.
Right.
Maybe.
And then I was talking to a colleague and found out they were really interested in it and would love that. And my mind was blown that anyone would want to do this. And so, you know, I very quickly offloaded the task to this person. And we were both much happier as a result. And so, you know, that's an important component of career development, professional development, just life development in general is, you know, looking for solutions outside the box, recognizing what you like, what you don't like, what you're good at, what you're not good at and don't care to be good at. You know, it's okay to not be great at everything. It's okay to say, this is not my thing. I'm not going to pursue this anymore. And I'm going to spend my time and energy pursuing this thing that I am passionate about. And I think oftentimes we make our own opportunities that way. Like in my position as the director of wellness programs, that wasn't a position. That was my side passion project because, as I said, I was doing this research on individuals who had, you know, developed severe impairing conditions. And it lit this fire in me that we need to be doing more preventatively. And so I just started working on that.
That is pretty cool, yeah.
Not as, you know, a part of, not a real part of my job. It wasn't part of my annual evaluation or anything. But because I was doing the work, then it kind of grew. And then, you know, there was more excitement and enthusiasm about it. And, you know, our former dean created a new position, a new college level leadership position. And so I was the natural choice because I was already doing this. And you hear those stories, I think, more often than you would recognize it, or you would initially think that, you know, people sort of make their own destiny a lot of the time by finding something that they care deeply about and pursuing it. And, you know, it may be that that's taking some time away from other things. And that's part of the balance, right? Depending on where you're at in your life, you may say, right now, my focus has to be on my romantic relationship. I'm in my first year as a newlywed, and we need to focus on building a strong foundation.
Right.
That's okay.
Right.
Do it,
Right.
you know, or I just had a baby. Right now, I'm going to focus more of my time on that, or, you know, whatever. Cool. Go for it. That's your choice and your decision. But it's also your decision to say, right now, I'm at a place where I can invest a little bit extra time in my career passion, in,
Right.
this meaningful work, and
Like,
figure out a
no
way.
kids, no wife. Let's try to do this max right now.
Yeah,
Right now.
Or whatever. Again, there's different phases in life. Like
Right.
now all my kids are in school, so now I have more time to pursue
Mm-hmm.
these things, or my kids have left for college, or whatever it might be. But we all have these different phases, these different ups and downs in all aspects of our life,
Right.
whether it's our relationships, our families, our work, whatever. And so, you've probably heard the saying before. I'm probably going to say it wrong. You can have it all, just not at the same time.
Okay.
And so it's this idea that it's okay to not be everything to everyone all at once. That you can kind of pick and choose, where am I going to put my focus right now, and what matters, what's my priority right now for this phase.
It made me laugh because you said exactly the title of the movie, one of the movies that I love the most. Did you see Everything Everywhere All at
No,
Once?
that's on my list that I want to watch.
Lisa, come on. Basically this movie is, the message of the movie, in my opinion, is exactly what you're talking about.
Okay, then I definitely need to watch it.
Exactly. Like, you could just give this 20 minutes, 30 minutes that we've been talking about, give it to the writer, say, think of a story and do this story with this message, and that would be the movie that would come out. With a little bit more like surrealism and pretty crazy stuff that at the same time, but I think that's the message that movie is wonderful. So yeah, thank you for being the personification of that message in your day life, because that's basically what your work is. Like, whatever this message is that you're giving me, you are trying to present that to other people, so that like, other people can really put it into their core and live their lives in that way, kind of a thing, which is pretty cool.
Yeah.
So I'm not sure. Yeah, we'll talk about. Let's just do a quick aside on the drugs thing. You wouldn't call them drugs, right? Or would you, like, just the problem of like substances apply to medical professionals, or not even medical professionals? Because from what you were telling me, you're interested also in the addiction and all that relationship that people have with substances as a general population as a whole, right?
Yeah, I mean, my niche population is really the licensed healthcare professionals. That's where I focus, but there's a lot of similarities and overlap.
So, just quickly, why is that problem interesting? Like, because I imagine it can vary a lot within substances, right? Maybe like this one is just kind of like affect. I don't know. I was just gonna say some very not smart things, like how, if it's like the biology or the psychology that is affecting me or something like that. But I'm not sure. What is? I think our question is, what is the role of substances in the medical professional, substance use in the medical professional life, and how do you deal with that relationship?
Yeah, so again, I think there's going to be very wide variability, right? The most common substance that is misused or abused, or whatever terminology you want to use, we call it a substance use disorder now to kind of destigmatize it, right? But the most common substance for diagnosable substance use disorders in healthcare professionals is alcohol.
Right.
And so, that's...
I would say entire population too, right?
Yeah.
I would imagine.
Right. So, it's a legal substance. Many people are exposed to it fairly early on. We know that the earlier in life that you are exposed to substances, the higher your likelihood of developing a substance use disorder, because your brain is not fully formed yet until you're about 25. So for every year that you can delay substance use, it's going to decrease your chances of developing a substance use disorder. So, for example, people who are drinking alcohol regularly by the time they're 14
I started at 15 in credit. I don't drink anymore, but I started pretty early.
Yeah. So you have a very high likelihood, because your brain is changing so much over that decade that the impact that the substance can have on it, makes it more vulnerable,
Yeah.
right? So it's actually a good thing that we have the drinking age and even the tobacco age is increased to 21, because if you can delay until the age of 21, it significantly decreases your chances of developing a use disorder. Now, opioids are probably the second most common substance among healthcare professionals, and now we see that in the general population as well. So it was prior to the explosion of oxycodone and OxyContin and Vicodin and fentanyl and all these things that are now much more widely available to the general population. It was a problem in healthcare professionals first. And now it's sort of seeped into the general population as access has increased in that regard too. It used to be, if you were just, a non-healthcare professional, it was hard to get access to these drugs until they became so widely prescribed and available so much more. And then now, of course, with the illicit fentanyl, it's just exploded out of control. But, there are certainly healthcare professionals who can be, what you'd consider a social drinker, someone who has less than 7 drinks per week if it's a woman, less than 14 if it's a man, 1 to 2 drinks per day as the max. And that's fine. There are other individuals who that's not possible for them, where 1 drink is too many as well as not enough, right? So there are individuals who have developed a substance use disorder. Typically, if you're a healthcare professional who has a moderate to severe substance use disorder, so what we think of as addiction, then the recommendation is total abstinence for the rest of your life, because it's very
that kind of can get you back. I
right,
imagine.
because even addiction is very sneaky. And so you might have said, my problem was alcohol, so I'm just going to use medical marijuana now.
Right.
And what happens often is that the brain just switches gears and now the marijuana becomes a problem. Or, I had a problem with pain pills, but I can still drink. Like, no, it's probably not going to work out for you very well. And what tends to happen is that the addiction will come back. Either the use of the new substance will cause the person to go back to their substance of choice, or they'll just develop a new problem with the new substance. And so it's much easier to just have that hard stop, to not try and go back to, well, I'll just try moderate drinking again. Right. It's very difficult to do once you've kind of crossed that bridge into a severe, moderate to severe alcohol use disorder. So because of that, the healthcare professionals, when they get their treatment, go typically for intensive treatment, residential level treatment for 1 to 3 or 4 months at a time often. And then after that, there's this expectation of abstinence where they're typically participating in mutual support meetings, whether it's AA or NA or something similar to that, Smart Recovery, something like
Anonymous,
that. Right. Or, specific groups for healthcare professionals in recovery. And then they also get monitored. So they'll have random urine or sometimes blood or breath substance use testing. So making sure that there's no recurrence of use, because if you can catch it early, then the person has a much better chance of stopping, the use, preventing a full-blown relapse, and, maybe getting some more treatment or some additional support or, monitoring closer to help make sure that they are maintaining their abstinence, their sobriety. And so what we see because of that, the healthcare professionals have this high quality treatment followed by this long-term aftercare where they're, engaged in these mutual support groups and having the monitoring. The rates of recovery are extremely high. So 5 years after treatment, about 80% of them are still in recovery and typically working, versus in the general population, after going to treatment, a year later, it's maybe half of the people, 40 to 50%, are still in recovery, because it's a terrible disease and it's very difficult to overcome without adequate support. And so that's why I'm really intrigued by this particular population, is because they're proof of concept that we can effectively treat addiction and that people can recover and can go on to have a totally fulfilling life as a productive member of society. But we're not giving adequate care to people typically. There's not enough money invested in substance use disorder treatment. It's not well covered by insurance typically. We don't have enough space in programs where there's not enough beds. And so, from my perspective, if we can continue showing this can work and figure out why it's working, what are the specific components, can we then adapt that and disseminate it to the general population as well and improve rates of recovery for everybody as a whole.
And you've just talked about, and I think I would imagine all of this applies to students, right? Like to any age, it's like, yeah, you have to be mindful of all of these things, like substances, relationships, because you were mentioning, like, relationships can help you with substances, right? Like if you have your father, your mother, your best friend, it's like, hey, you gotta watch out with this drinking, like you've done it a little bit more than you're normally doing it or something like that. That's immensely helpful. But I did want to ask you, like, now think of the students, like, what would you, or like maybe like a younger Lisa, maybe not a younger Lisa, like a general population of students, like young people, what is your advice to them? Like, knowing all of this wellness and doing all the work, what is like a good, strong advice for them?
There are so many options to choose from.
Right.
I would say, first of all, if you're struggling, the earlier you reach out for help, the better.
That's a good one.
Because the longer you wait, the harder it is to recover. So our brains can kind of spiral down very quickly. And, if you think about it, a condition like addiction or depression, these are brain disorders, right? It's a problem with your thinking. It's a problem with how your brain is functioning. And so the more severe it gets, the harder it is for you to think clearly and to have good decision making, which means you continue making choices that make the problem worse and worse. With, depression, for example, if a big part of the problem is how you're thinking about your approach to life and you don't go and get help to stop that, then your life starts to emulate the way you're thinking about it, which then makes those negative thoughts become truer, which then causes you to have more negative thoughts, and it can really get bad very quickly.
It's like a feedback loop.
Right.
In your brain.
And it also, these conditions tend to isolate us, right? So we know that addiction is a very isolating disease, and there's actually some evidence, even with animal models, that having social connections and strong, nurturing relationships can protect against addiction or even help with recovery from addiction. And that's, again, even in rats. So it kind of shows how important it really is. That's a big part of participating in something like Alcoholics Anonymous. You have a community now. You have a support network. You have a sponsor. You have people who are there for you and with you, who care about you, who, it's an antidote to the isolation that causes people sometimes to go back to drinking or using. It's that pain, that abandonment, that isolation that feeds a lot of the behaviors that can lead to addiction, I think. So I would say, if I was talking to a younger person, my first piece of advice is reach out for help at the first sign of a problem, because you can avoid so much difficulty doing that.
Yeah. And
there's
it can be
so
friends,
much hope.
It can be parents.
Right.
Just reach out.
Yeah. And there's so much help available now that there wasn't, a couple decades ago, in terms of access to mental health care, access to different programs at the university, access to supportive friends and family. I mean, not everyone has supportive friends and family, but more people are more knowledgeable now about mental health issues and have an easier time talking about it. And then the second advice I would give is really to nurture your relationships that are important to you. Don't put your work or your school in front of the people that matter most to you, because the reality is that you're going to need them. You're going to need them to get through the tough, career challenges. You're going to need them to get through the tough life challenges. And they're what's going to make life worth living for most of us. When we're on our deathbed, which hopefully, we'll have the opportunity for, and you're looking back at your life, this is so cliche, but nobody ever says, gee, I really wish I had worked a lot more. They think about the regret comes from things that you missed that were people-centric. And so I'm not saying, don't do your homework or don't go to work.
Right.
But
you are saying, like, write to your mother.
Yeah. Keep in contact with the people who matter to you, make time for them when you can. I'm not saying don't do the stuff you need to do, but maybe spend less time, on TikTok, or less time scrolling through Netflix and never picking anything to actually watch, and invest some of that time that's otherwise wasted into, like you said, calling your mom or texting your best friend, or, reaching out and joining a club, something where you're forming important social and relational connections.
I think that's a wonderful end to this, Dr. Merlo. Thank you so much.
My pleasure.
Yeah, this was wonderful. Yeah.
You might not have a job that feels immediately meaningful to you in the present moment, but you can find meaning in the work itself.
Right.